let me give you a quick update on fracking, just quickly. If you've been following, I won't, I can't do it all if you haven't been following it. This is just for people that are sort of familiar. The DEC's been doing the SGEIS, the environmental impact statement for 4 years now. 2 comment periods, a lot of blowback from the state, 14,000 comments, 80,000 comments, and now on the rules, 200,000 comments to the DEC. This is just unprecedented outpouring of concern and unhappiness.
Makes this evening look like nothing, right?
Yes, yes. That poor DEC, poor Joe Martens,
I was there. I saw you question him.
We all get our turn to go at these public officials, and I can take my punches as well as deal with them. This process is nearing its end, apparently, as far as we can see it. Can't be sure yet, but they've been doing this health review that they just started doing a few months ago and back in September. I have complained about it. Many people have complained about it, that it's a secret review. They're not doing it out in public the way it ought to be done with a written public note. What is it they're reviewing? We don't even know really what they're looking at. And they said, well, it's this little document. Then they said, oh, it's the whole SGEIS. And, it's all been very messy and not transparent. So I and many others have said it ought to be written public notice. We need public hearing on it. We need to know what you're doing. We need experts, around our state. We have so many experts that have been looking at this issue. Let our doctors and our nurses and our researchers and scientists testify before these experts and tell them what they know and what we ought to be looking at and looking for. That hasn't happened. And we want public comment that the DOH or DEC, who's ever doing this review, it's not even, clear who's really in charge of it, has to respond to. So we want it to be the full open process that an SGEIS ought to be. This should have been in the original scoping document at the very beginning. Anyway, so they decided at the end they're going to tack on this health review that we don't know what it's about. They're going to bring they bring in 3 outside experts who seem like, are good people, are people of good reputation. But again, that's all well and good. That's not the way our process should work. It should work with New Yorkers looking at it in an open, transparent way. We don't want people from outside the state coming in and reading something and saying, yep, this is fine. We're okay with this. So go ahead and frack. That's just not the way our environmental law ought to work. And so a lot of complaints about that, but they keep proceeding. But they did say last Friday, a week ago Friday, they said it's going to take longer. Dr. Shaw, the Commissioner of Health, said we need more time for this health review. I sent a letter to the DEC, and it's going to take us more time. Commissioner Martens said, okay, so it's going to take more weeks. That means that the rules that we've been trying to work on for the last year are going to miss their deadline to come out. The SGEIS is missing its deadline. The rules miss their deadline 2 weeks later on February 27th. So that means the rules expire. Once the rules have gone over to the year process, they expire. And people thought, well, what does that mean? Does that mean that they're not going to be able to issue permits for fracking? Commissioner said, no, I don't need the rules to issue permits. This health review gets done in the next few weeks. It gets put into the SGEIS. The SGEIS gets issued publicly, all done with comment, no more comment on this, presumably. And it's done, and I can begin issuing permits. So he made very clear that within a few weeks, the SGEIS, the health review and SGEIS could be done. He doesn't need to wait, restart the rules process and get that all done. He said that's just codifying what's in the SGEIS. We don't need to have it. We will issue permits for each well, and we will put the regulations, the requirements in each permit, and that's how we'll regulate it. It's very enforceable, and I don't need the rules. So
you mean the rules will be based on the outcome of the health analysis? The rules are based on what?
He actually won't have rules.
The rules that were drafted presumably came out of the SGEIS, but actually they were done in tandem with the SGEIS. Usually, you would do an EIS and then the rules would come after it, right? But this time, because they said it's taking all this time and we're just going to start doing the rules even though the SGEIS isn't done. So they started doing them in tandem. There was quite a bit of complaint about that they weren't waiting to finish the SGEIS before they started the rulemaking, because the rules are supposed to come out of the SGEIS, right? And so nonetheless, they continued. and now they see the problem with doing that because, you know, they weren't done with the SGEIS, so the rules expired, and, you know, it sort of.
So they're gonna do it without rules.
So he said, I have the ability, I believe, my reading of this is that I don't have to have the rules, and other people have said they've done this without rules before. They have issued permits without rules in place in the earlier SGEIS on gas drilling. And he believes he can do it and issue permits without the rules. So that's where things stand now.
Without any scientific data on the health impact.
Well, he says that the health review will be done. The health review will go into the SGEIS, so we will have the health review. And there is no conclusion on that yet. We could still have Dr. Shaw say, you know, our investigation shows that it's not safe, or saying we need more time. Again, I don't know. We don't know what's going to happen with that.
Can they use any?
But they said a few weeks. They did say, I think Dr. Shaw said it's going to take us a few more weeks.
Can they use any data from Pennsylvania? I mean, I just heard that Geisinger got a whole lot of money to study.
Yeah, that's interesting.
Can any of that be of use to?
Well, presumably. It looks like a real health study, $1 million for a real health assessment, which is not what we're doing now. Mm-hmm. And I'm certainly going to argue that we ought to be waiting for that study. And I'm also saying that there are a lot of other outstanding issues. Wastewater treatment and disposal. It's just, you know, we'll see what they put out in the SGEIS, but they really have no plan for wastewater treatment and disposal.
So are we still in a moratorium then?
We're right now.
And so our gas leases are just sitting idle. Is that right?
Uh-huh. We're in a moratorium still.
And there is no cutoff date on that. There was no set date when that was going to come to an end, right?
Well, as long as it's a de facto moratorium, it's not a law, it's a de facto moratorium. As long as the SGEIS was being worked on, they weren't going to be issuing permits. So it was just a de facto moratorium. There had been a legal moratorium that there never was. Both houses passed a moratorium in the first year of this, but Governor Patterson vetoed that, if you recall. So we never had a law that was a moratorium. But he put out the executive order 41 that said, you know, we need to look at this whole thing a lot more. So he actually did something very good in doing that executive order and said, we haven't done this, we need to look at we need a comprehensive look at this. So we were actually happy with his order because it was a de facto moratorium and it called for a much broader study in the SGEIS.
Well, that, I'm not clear then. So is the clock ticking on the gas leases that people have, or not?
The clock is always ticking. Most of those are 5-year leases, and some people's leases are up. And
my understanding was once that moratorium went in place, everything came to a halt.
No, the gas companies were arguing force majeure, saying those leases shouldn't expire because an act of government is preventing us from drilling. But that the courts have ruled against them, that it's not force majeure. It's a normal act of government. And that's not you know.
So there was no stopping of the clock.
No.
So they
lost that argument.
They'd have to renew their leases.
They're working to renew
5 years.
leases. Some people are letting theirs expire. Some people are actively trying to have their leases expire. Some people are wanting to renew.
And they can be renegotiated.
If they're expired, it's tricky. You know, I mean, I held a forum on gas leases, and whew, boy. Even the lawyers are struggling to figure out how to, you know, it's very tricky. They've got a lot of power in that situation. But technically, the gas companies. But technically, yes, you could renegotiate your lease. And, you know, some people are managing to do that.
I've been to several meetings on this issue, and everyone I go to try to get educated on fracking, and everyone avoids that subject. They don't educate you.
It's a very complicated. I had a full gas forum last year.
They answer a lot of million other questions, and people get irate and all that good stuff. But nobody really tells you the actual procedure and what is used.
You need, I had 2 lawyers doing the forum. One was Joe Heath, that's worked on this issue forever, and the other was Guy Crow, that presented from the city of Ithaca. He's done a lot of work on gas leases. And boy, everyone there was just shaking their head. It's just so complicated. And the leases are written in such a way that it's very hard for the leaseholder to, you know, get out of the lease and change the lease. And
have any leverage.
have a lot of leverage. It's I can't remember. I mean, it was painful. By the time I got on, I went, oh my! It was just mind-boggling.
Is Lifton and Ithaca working on this?
Yes.
Okay, there's
yeah, they were at the forum. They were at the forum.